Okay, terrific question. So let's go over this again. We'll go ahead and record this because this is great. Okay, so first of all, a common question is, should I take liquid vitamins? We said no. Generally, the iron in there is either at a low dose or bound in such a way it's hard to absorb because the taste of liquid iron is unbelievably bad. Same thing is true for the Flintstone vitamins, so we don't recommend them. If you can eat a vitamin with iron, it either doesn't have much iron in it or it's bound in such a way that absorption's impaired, because the taste of raw iron is like eating rust, because that's what it is. Eat rust. No. So take your tablets and remember that raw rust into the gut doesn't feel good. It's unpleasant and can upset your stomach, so you need to take it with food. Now when you take it with food, there is a decrease in absorption if you take it with certain kinds of foods. So, but better you should get it into the gut and then give it a shot at being digested and absorbed. Now, a terrific follow-up question is, gee, if you have trouble absorbing iron and some other vitamins and minerals like vitamin D and calcium, do I also need to double up on my dose of ampicillin when I get an ear infection? Or do I need to take a double dose of something else when I have a prescription from my doctor? And the answer to that is no. Iron is not easily absorbed by your body. Calcium is not easily absorbed by your body. Vitamin D and vitamin E are not easily absorbed by your body. Almost all other drugs are very easily absorbed. They're kind of like salt and water. They're easily absorbed. Ampicillin, penicillin, Keflex, blood pressure medicines, cholesterol medicines, all of them are easily absorbed. Therefore, you should not adjust the dosage of your blood pressure, antibiotics, or things like that because of the gastric bypass. Now, having said that, there's a little trick to it, because what if your blood pressure or your diabetes goes away? You should adjust the dose down if your illness goes away. You should not adjust the dose if you've got an illness, like an infection. You shouldn't double your dose. The reason is that iron has a special transport protein to absorb it. Ampicillin does not. Almost all drugs are very easily absorbed in the upper gut. So it's a really good question. Again, just to summarize, the best vitamins are the big old, plain old Walmart One Source. We know that from thousands of patients who've taken it over 10 years. Do not take liquid vitamins. Do not take chewable vitamins. Because vitamins can be a deficiency, it's a good question, should I change the dose of my medicines when I get an ear infection? And the answer to that is no, because the drugs are absorbed easily in contrast to iron and calcium and vitamin D, which require specialized transport to get into the body. Ampicillin, penicillins, Keflex, drugs like that, very easily absorbed. So you don't change that dose, and if you do change that dose, you may harm yourself. Now, if you're taking a blood pressure medicine, cholesterol medicine, or diabetes medicines, we're going to change those doses because we're going to make the illness better, but not because of absorption. So it's a really good question, a little bit technically complex, but I hope that that kind of answers your question. Does that sound right?
Could you repeat that? She was kind of hard of hearing and she couldn't quite...
Sure. The nice thing, too, is remember this is videotaped, so you can go watch it again. And if you're not clear on any of this, we're going to go over things again tomorrow, and we're going to have the videos so you can watch them online. But let's do it one more time. Children's chewable vitamins or liquid vitamins we don't recommend because we think they're unnecessary. They either don't have enough iron or the iron is bound in such a way that you can swallow it. Because the taste of raw iron is rust and people spit it out. They can't stand it. When you bind it up in those forms, it's often not well absorbed. So we don't like the liquid and chewable iron. We do recommend vitamins, but we recommend the cheap, plain old Walmart one source or whatever ones you want, nothing special or expensive, because we have data on thousands of our patients over 10 years, and they all have pretty good numbers. For example, everybody has sky-high folate. Very rarely do they have low B12. Probably a handful of people out of 10 years and 4,000 people. So it's rare to see a low B12. So we don't recommend B12 shots or supplemental B12 beyond just taking what's in your multivitamin. If you swallow a big pill and it doesn't go down, instead of switching to a tablet that you can chew or a liquid, you should call me, because there's something wrong with the surgery if the tablet doesn't go through. As far as medications, your medication list may be modified by the surgery because we may cure you of diabetes. On the other hand, if you get a wound infection, if you get a tooth infection and you need antibiotics, you do not need to change the dose because of your bypass. And the reason behind that is the drugs themselves are easily absorbed, much like salt and sugar and water, which are very easily absorbed by the body, and not at all like iron and calcium and vitamin D, which require specialized absorption techniques by the body. Yeah?
I take fat-soluble supplements, and they say to take them with a meal or with a small amount of fat. Does my stomach break down that capsule? My omega-3 and my vitamin capsules enough to where I'll absorb it, because I don't see it later, you know what I mean?
Right. That's a really good question. So the question is, if you eat fat, or if you take a fat-soluble vitamin, or if you take something that's oily or fatty, will you absorb it? And the answer is yes, but it's decreased. If you think about it, the gut and the body are remarkably well adapted to absorb fat. Fat without the specialized connections of the pancreas, the gallbladder, and the liver cannot be absorbed by the body. The body is fitted with a fat digestion and absorption system, and in my patients, it's working too well. You're heavy. You're digesting and absorbing fat too well. So when we bypass the upper gut, where the gallbladder transmits the bile and the pancreas puts the pancreatic enzymes into the gut, we interfere with, but don't stop completely, the digestion and absorption of fat and fatty vitamins. When we decrease your digestion and absorption of fat, that's good, but we don't want to lose all the good fats. So that's why we recommend a touch of additional fish oil, because we'd like to buff up, in part, a little bit of fish oil.
My fish oil is 1,000 milligrams, and it says like 3 a day. Is that a lot?
Well, it depends on your gut. If you have trouble digesting and absorbing fat, and you take a lot of fat, you may find a surprise down below.
Okay, I don't. So
then you're okay. But beware of taking a lot of fat, because as you take more and more fat, you increase the risk that you're going to face a complication of some of that fat.
Agent Orange?
Yes.
Okay, I haven't had it in probably almost a year.
Good.
One other question.
Yeah.
The capsules.
Yes.
That the vitamin powders and stuff are in. Those get?
They're gelatin and they're rapidly dissolved. Yeah.
Okay. So
they're like the pill coating that's there for Keflex and stuff like that.
Thank you.
Good. So those are all good questions about tablets and medicines.
Oh, mine was excellent.
Yours was. I'm going to bypass an extra foot.